is Kendra Morgan. I'm a Senior Program Manager here at Web Junction, and I'd like to thank you all for joining us today. We do have a nice big group of panelists and moderators today to help with the session. We're joined by Liz Morris, who's the eHealth Project Coordinator here. And we also have David Santana and Tarnisha Brown joining us. And you'll notice that Tarnisha's name, she has CMS after her name, and so when she is chatting, you'll know that the responses are coming from CMS. It's great to have them here. They're wonderful partners in helping to connect libraries to information about the Affordable Care Act. And our panelists today, we have a nice set. So we're joined by Susan Hildreth, the Director of IMLS, Susie Butler, who's the Deputy Director of Partner Relations at CMS, Evan Gallagher, who is part of the team at Zero Divide, who are our partners in this project. We'll be talking about some of the policy issues surrounding the ACA. And we're also going to hear today from two great libraries. We've been so excited to be able to start connecting with libraries who already have plans in place to support patrons in their community who have questions around the ACA and general e-health questions. And so we have Carmen Patlin and Tatiana Alonso from the Waukegan Public Library in Illinois, and we have Lissa Staley from the Topeka and Shawnee County Public Library. And you'll get to hear a little bit about what's happening in each of their libraries and the plans that they have moving forward. So we're going to go ahead and start today's session. Today's webinar is called Meaningful Use, Libraries Connecting Patrons to ACA Resources. And this is the second webinar that we have offered as part of a grant project that we are working on with the Institute of Museum and Library Services. And to help put a little context around the project and the work that's happening in libraries, please welcome Susan Hildreth.
Well, good afternoon, everyone. It's so great to have all of you joining us. I'd like to just acknowledge the great interest in the work with the Affordable Care Act, and we're really excited to be able to create such a great team of partners to help support the important efforts going on in our library. So I would like to just officially thank our partners who are joining us today, the Centers for Medicare and Medicaid Services. They're doing a terrific job. Also, we're working closely with the National Network of Libraries of Medicine. We don't have a representative on our discussion today, but that's a great network for us to connect with and get information out. Of course, our good partnership with Web Junction and Zero Divide, who really brings a unique point of view to all of our work. And I'm really excited also to welcome our libraries today, Waukegan and Topeka, Shawnee. And I just can't resist plugging the Waukegan Public Library was an IMLS National Medal winner for 2013. So we really are proud that they're taking on this great effort seriously, and just wanted to let everybody know that if you go to the IMLS webpage, you can find out all about applying to be a national medal-winning library or museum, and you still have until October 15th to do that. So you'll have a few weeks after October 1st hits when the ACA rollout goes on to think about that. Just briefly, I wanted to ensure all of you that we really want to focus the role of libraries on connecting patrons with help and knowledge about the Affordable Care Act. We don't anticipate that all of our library staff will be experts in the information regarding the Affordable Care Act. In fact, our partnership with CMS is really helping us understand the facts and specific information about activities in the program, and we're really most focused on making sure all of our customers know where to go to get good information. But again, we don't expect or think that librarians are going to be experts in this very complex topic. Also, we want to make sure that in your local institutions, you are following the guidance or direction of your library board, your city, your county. We certainly think supporting and getting the information out about the Affordable Care Act is critical activity for all of our public libraries. But we also know that you're operating in your own local context, and you should certainly follow any kind of local advice or guidance you have in terms of your effort of involvement with this work. So I'm going to hand this off to the rest of our exciting presenters. We have a great group today, and I know it's going to add to your knowledge base, and I'm really excited that we're archiving this so folks can come back and check it as if they weren't able to get on. And it's just really a great opportunity to continue to inform all of you about this important work. So thank you all, and I'll pass it back to Kendra.
Thank you so much, Susan. Before we dive into today's presentation, we wanted to make a quick note, and you'll actually hear Evan discuss this in a little bit when he talks about some of the policy issues, and that it's really important to know how your state is choosing to participate in the ACA. And so there are three different setups that can really impact the types of resources that are available within your state. And so we have libraries, or states rather, that are participating in this federal exchange, and those are in the light blue on the map. And then we have a partnership exchange, so they'll also be relying on the federal resources, and those are in the medium blue. And then we have state-based exchanges who are taking the lead in developing their own marketplaces for health insurance, and also have their own website. So it's really important to take note of which state you are in and what resources might be available to you. Our folks and partners at CMS will be talking a lot about the federal marketplace, but you can also connect to your state marketplace through healthcare.gov, and we'll cover that a little bit more when we get to that section. But we do want to highlight that it's very important that you, if you are in a state that is running a state-based exchange, that you definitely want to look at your state resources and opportunities as well to make sure that you have the most comprehensive information. And with that, it is my pleasure to welcome Susie Butler from CMS, who's going to give us an update of what's been happening with the health insurance marketplace and with the CMS team. Welcome, Susie.
Kendra, thank you so much, and I also want to thank Susan for the warm welcome and introduction, and I want to thank all of you on the line. As Susan said, each of you need to decide how your library will participate, but we know that people will come to the library because they're looking for information, and the library is an honest broker of that information and often the only holder of that information, particularly in small communities. So we thank you for being a repository, and we thank you for being there, and we hope you can participate at some level. I'll also say, and she didn't know I was going to say this, but one of my colleagues whom I'm sitting in the office with, Lynn Johnson, on our staff is a librarian, and so we keep the libraries close to our heart and in our daily business, because a librarian is always a librarian, as Lynn quickly reminds me. She may have been in federal service for a number of years, but she's still a librarian. So let me talk to you a little bit about some of the resources that have been in the news lately. You may have heard that the Health and Human Services recently announced a $67 million grant award to over 105 navigators. These applicants are in federally facilitated and state partnership marketplaces. These navigator grantees and their staff will serve as in-person resources for Americans who want additional assistance in shopping for and enrolling in plans in the health insurance marketplace beginning this fall. The marketplace, as you may know, opens October 1st, and we see that the navigators may reach out to you as libraries for a place to meet people who may not be able to come to their place of business. So just know that the navigators are people we've awarded grant monies to. HHS has also recognized more than 100 national organizations and businesses who have volunteered to help Americans learn about the health care coverage available in the marketplace. Navigators will be among the many resources available to help consumers understand their coverage options in the marketplace, and a network of volunteers on the ground in every state, healthcare providers, business leaders, faith leaders, community groups, advocates, and local elected officials can help spread the word and encourage their neighbors to get enrolled. Navigators are trained to provide unbiased information in a culturally competent manner to consumers about health insurance, the new health insurance marketplaces, qualified health plans, and public programs, including Medicaid and the Children's Health Insurance Program. The Navigator funding opportunity announcement was open to eligible private and public groups and people who who are self-employed who met certain standards to promote effectiveness, diversity, and program integrity. Navigators will be required to adhere to strict security and privacy standards, including how to safeguard a consumer's personal information. They'll be required to complete between 20 and 30 hours of training to be certified, will take additional training throughout the year, and will renew their certification each year. All types of enrollment assisters, including in-person assisters, certified application counselors, and agents and brokers, are required to complete specific training and are subject to federal criminal penalties for violation of privacy or fraud statutes on top of any relevant state law penalties. Navigators have a vital role in helping consumers prepare electronic and paper applications to establish eligibility and to enroll in coverage through the marketplaces and potentially qualify for an insurance affordability program. They also provide outreach and education to raise awareness about the marketplace and refer consumers to health insurance ombudsman and consumer assistance programs when necessary. Navigators play a role in all types of marketplaces, are funded through state and federal grant programs, and must complete comprehensive training. There's a lot of training material that's available for partners. There are web-based trainings. There's an overview of the marketplace, Health Insurance Marketplace 101, all sorts of things that might be interesting to you as librarians, as well as to some people who might ask you some questions who come in looking for more information. Most of these are available at the link that is at the bottom of the slide that's on your screen right now. Anything that's on the marketplace.gov site or on the healthcare.gov site is available for download and use. These are considered in the public domain and are usable by anyone. So on the next slide, I want to talk to you about the Champions for Coverage. This program has just started 3 weeks ago, but has become wildly successful, and it's a way for you to get enrolled and involved and in your community do something special. A champion is someone who is willing to share information or outreach materials, be that a business card with a link on it or a web address on it, a poster in your place of business, in this case maybe at the information desk, or just tell people about where to find more information. To be a champion, you should go to healthcare.gov and scroll down to the very bottom of the page, and it says Information for Partners. You click on that link and it takes you to Champions and Assisters, and you can click on the Champion button and then sign up there. We've had a number of libraries sign up because they're willing to distribute information and help people in their community. One of the things that you can also do is if you have an outreach mechanism to your community, you can post the Marketplace widget or use some of our downloadable materials that are on these resource pages to send information and educational articles to people in your community or your library patrons. These are updated on a regular basis, and we're seeing more and more materials go up each week. This week we posted a number of materials for back to school. So again, we're trying to be attentive to the people where they are and what they're doing. We also have a number of ways to follow, including Facebook and Twitter. And we also have our Spanish language website, cuidadodesalud.gov. So with that, I'll send it back to Kendra.
Thank you so much, Susie. Just a quick note to everyone, we do see your questions coming through, and we know that the team at CMS will be able to answer some of them through chat, and we will also write down your questions and talk to our presenters at the end during the Q&A session. So with that, we'll move on to Evan Gallagher from Zero Divide. Evan, welcome.
Thanks, Kendra, and good morning, everyone, from here on the West Coast. And thank you, Susie. I'm going to go ahead and build on and reiterate a lot of what Susie started to talk about, and then dive a little deeper into some of the issues specifically relating to libraries. What I want to start with is a little bit more about what exactly the different health insurance marketplaces are. The marketplace, or exchange as it's more commonly known, is a competitive marketplace for insurance created by the ACA. This marketplace provides a space for consumers and small businesses to shop for qualified health plans with very clear, mandated, and defined levels of coverage and benefits. It also allows for the consumers who use it to quickly determine whether they qualify for subsidies or for state-run health insurance like Medicaid. The marketplaces will be operated in every state, either by the state itself, by the federal government, or via a partnership between the state and federal government. For all the federal exchanges, the actual website will be healthcare.gov. So, as a first step for libraries, what you should do is try to understand exactly what type of exchange is operating in your state, and then identify what is the most direct source of information that you can have for your exchange. The first thing you can do for any state is go to the healthcare.gov site, and the what is marketplace in my state drop-down menu. Here you can get the basic information. Excuse me. Here you can get the basic information and a link to your exchange's website. Again, if your state's using a federal exchange or a federal partnership exchange, healthcare.gov will host the marketplace in your state. Otherwise, there will be an equivalent state-run exchange opening on October 1st. So what does enrollment actually look like when it's starting on October 1st? The first thing to know is that the system will have multiple options to enroll, including an old paper and mail system, as well as enrollment via phone. But the majority of new enrollees are expected and will be encouraged to use the online system. The online application is convenient for a number of reasons, primarily because it includes applications not just for private insurance, but also for Medicaid and other public forms of insurance. In addition, the online exchanges will allow for nearly instant verification of important eligibility criteria such as income and employment status. And related to that, because eligibility for subsidies will be determined immediately in real time, patrons will know which insurance they can get almost on the spot rather than waiting weeks in traditional insurance application processes. The key thing to remember, regardless, is that everyone will be eligible for some sort of insurance, no matter what their income or employment status is. So I want to talk for a moment about an important trend related to libraries. Increasingly, today's public libraries are serving as critical resources for information related to health and wellness. And there's a lot of evidence that this library role as a partner in health is continuing to grow and will continue to grow into the future. A recent study by the Pew Internet and American Life Project demonstrates that 47% of patrons who used the library computer in 2012 said they retrieved some sort of health information. At the same time, the patrons who have been shown historically to value, utilize, and need their libraries the most, such as those in low-income or minority communities, are also the same patrons who are going to be encouraged and most eligible to enroll in new health care coverage under the Affordable Care Act. A parallel trend I want to talk about for a moment is the growing importance of electronic health tools. Our healthcare system is increasingly encouraging individuals to engage with their healthcare online and via digital tools. Experts believe this is going to improve quality, improve patient experience of care, lower costs, and improve overall health and wellness in the future. The emerging group of apps, websites, and general online resources that allow you to engage with your health online are what we're calling e-health. And e-health is part of the broader role that libraries can play in creating equal access to resources for all citizens through digital inclusion. And several mandates at this moment have been created by federal policy that make the goal of digital inclusion via e-health very critical. First, as we discussed, the Affordable Care Act encourages folks to enroll via the web. Second, increasingly, the federal government is encouraging and enforcing healthcare providers to use electronic health records. And in a related associated patients' rights laws, providers are required to share electronic health data with individuals, and the ability to access, view, and control one's health records is part of a broader movement to increase patient empowerment and engagement. So these three trends make e-health and digital inclusion ever more important as a role for libraries. So what does enrollment support actually look like at the library? The key message I want to convey is that library staff can play a very wide range of roles in connecting independently. Others, as you'll see later in today's presentation, may have staff trained to provide in-person assistance or provide library space for other qualified consumer sisters or partner organizations. Whatever your library chooses to do, that's up to you and will be based on your local needs and priorities. We also want to talk about patient privacy, and we know that that's an important priority for libraries. Well, one thing to note is that unlike in the past, this process will not require your patrons to enter an extensive medical history to get insurance. They will, however, have to enter some detailed and personal information. And this is where understanding your library's privacy guidelines and policies is very important. Your staff may choose to review and apply your current and previous policies regarding information services for other government resources that involve personal information. Some examples of these policies would be ones related to tax forms, unemployment application, or immigration resources. And you can take those policies and perhaps apply them to the Affordable Care Act. However, I'd like to reiterate that as a librarian, you should not expect to sit down and take patrons through the entire application process unless that's a decision your library makes on its own. While libraries are an important resource for ACA information, you're by no means the only resource for information in your community. You're not alone. Libraries should think of themselves as part of a mutually reinforcing network of organizations. As discussed previously by Susie, there's a network of local community organizations designated as assisters or navigators in your community, given funding to help enroll people. They're trained to be culturally competent, and they're there to take your patients step by step through the process. Further, local community health clinics also have trained individuals to help educate and enroll your patrons. Some of these trusted organizations may choose to locate themselves at community anchor institutions such as libraries. You may want to consider reaching out to these local organizations to determine how they fit within the broader network of ACA support. In addition to these community resources, other resources will also be available at the federal level, including a 24-hour call center with language support for those states operating federal and partnership exchanges. And then remember that information on all these community resources can be found at the healthcare.gov site, the CMS website, or at your local exchange site as they become available closer to October 1st. Now, while you should adopt the strategies that make the most sense for your library, providing ACA information and enrollment support is a really great opportunity to expand the influence and role within your local community. The specific actions you can take in some are to first identify what type of insurance exchange is operating in your state and who your potential partners are. Then assess how your staff and your library can meet your patrons' information needs best. Then define the role that best fits your library and the resources available to you. And finally, remember to familiarize yourself with the healthcare.gov, web junction, and state exchange resources available to you. Thanks a lot. I'm going to throw it back to Kendra right now.
Thanks, Evan. I think that little overview about the importance of figuring out where your library can fit in the information request and how you can respond to patron needs is going to be really important for each library to decide as we move forward. And we're going to have the opportunity now to hear from two libraries who have already decided some of the actions that they would like to take in their communities. So please join me in welcoming Carmen Patlin and Tatiana Alonso from the Waukegan Public Library. Welcome.
Thank you. And first of all, I wanted to say thank you to Susan Hildreth for the IMLS Win shout-out. We are certainly very proud here at Waukegan. My name is Carmen Patlin. I'm the Community Engagement Outreach Manager for the Waukegan Public Library.
Hi, everyone. I'm Tatiana Alonso, the Promotores Ambassador Coordinator with the Waukegan Public Library.
I'll start off by giving you a little background of our work and efforts of engaging our community. Our Waukegan community is comprised of 54% Latinos. To many of these individuals, WPL was irrelevant. In our efforts to build relevant programming and services, we implemented the award-winning Promotoras Ambassador program. This program is made up of trusted community members who volunteer to do market research via surveys. These surveys have allowed us to structure our programming to bring down some of the barriers our community faces, such as lack of English speaking skills, literacy, computer skills, among others. By responding to the needs of the community, the WPL is now viewed as a trusted institution and relevant to the many individuals participating in our classes and services. so much so that word of mouth is our best promotional material. Our library is fully committed to the success of our community from top to bottom, with our director publicly stating his support for the well-being of our community, including the Affordable Care Act. Our role with the Affordable Care Act would not be possible without the full support of our director and staff. Not only are we relevant with the Affordable Care Act, but also being mindful that not all individuals in our community will qualify for access to the marketplace. As Mr. Lee states, health literacy has become one of our most recent initiatives. We have implemented a 4-week functional health literacy class that educates individuals on preventative health care and accessing primary care via our local health department and clinics. The library is a member of the Alliance for Human Services in Lake County, Illinois. The Alliance is a powerful coalition of organizations and individuals committed to continually improving the quality of human services available here in Lake County, one of those services being access to health and primary care. The Lake County Health Department, the Alliance for Human Services, and the Waukegan Public Library are part of the Enroll Lake County grant funded by the state. Enroll Lake County will allow the Waukegan Public Library to dedicate 3 existing staff members to focus on the Affordable Care Act. Based on the community demographics, we knew that language, space, and trust would play a factor in the success of Enroll Lake County here at WPL. Which is why the 3 IPCs identified are key in reaching our target audience. The 3 IPCs are fully bilingual, active, and already trusted in the community. Our goal is to help enrollees feel confident knowing that they are at a trusted institution that will provide adequate space for enrollment to take place. I will now hand it over to Tatiana, who will give you an overview on how the Waukegan Public Library will effectively serve our community with education on the Affordable Care Act and Enroll Lake County.
Thank you, Carmen. Before I go into detail of our work plan, I would like to again share a brief explanation regarding in-person counselors, otherwise known as IPCs, and Affordable Care Act navigators. The government is focusing on a nationwide effort that includes navigators and IPCs. Navigators and IPCs have the exact same responsibility to help individuals make an educated choice for healthcare coverage. The only difference is funding and the name. The navigators are funded federally and IPCs are funded through a statewide effort. Enroll Lake County and the Waukegan Public Library will be working in 3 phases in order to achieve our goal of enrolling 1,000 individuals during this open enrollment period. The first phase is extremely important for us to complete our overall goal. We will be conducting outreach and engagement, meaning we are taking the time to have a conversation with individuals and collect demographic data, explaining the importance of the Affordable Care Act and letting them know that the library will be available to assist them throughout the process. This will be an ongoing phase until March 31st, 2014, when the market closes. The second phase, we are expecting the marketplace to be open on October 1st. On this day, individuals can begin to enroll in their new health insurance plans, but their benefits will not begin until January 1st, 2014. Phase 3. The final stage is post-enrollment. Our IPCs will continue to case manage enrollees to assure that they are adequately enrolled and receiving their health coverage benefits. In the state of Illinois, all IPCs must attend a 2-day state certified training and are required to attend webinars provided by the state throughout the enrollment process in order to be updated and informed on the most current information regarding the Affordable Care Act. As IPCs, our goal will be to assist individuals in making an educated choice on healthcare options via the marketplace. We will not be influencing a decision on their part. We will accomplish this through workshops, drop-in labs, and one-on-one sessions. Our workshops will be a 45-minute overview of the Affordable Care Act, allowing time for Q&A. Our IPCs will be available for one-on-one enrollment sessions, averaging an estimated 45 minutes per enrollee. And for those individuals who feel comfortable with the online marketplace but might still need assistance throughout the process, we are offering drop-in labs scheduled to run for a 2-hour time period at our computer lab during the open enrollment timeframe. This effort cannot be completed with IPCs alone. This is an all-library staff effort. specifically with our customer service and reference staff. Our staff will be trained and will be prepared with basic information regarding the Affordable Care Act so that they may be able to engage patrons and collect basic demographic information from potential enrollees. Then our IPCs will be expected to follow up and schedule the enrollee in the appropriate working sessions. The demographic data is kept private and only with our IPCs once collected. What can you do at your library? Research. What is the current status of the Affordable Care Act in your state? Contact your local state agency overseeing the Affordable Care Act. Build a relationship and partner with your local organizations that are already taking an active role with the Affordable Care Act. Create and post a listing of enrolling agencies in your community. Train your reference staff, host educational workshops, and if still possible, host an IPC. And we would like to end with a list of resources that we have found to be very useful both for our IPCs and reference staff. And with that, back to Kendra. Thank you.
Thank you so much. It's really amazing all the work that has been happening, and I know that is in part because of your partnership with Enroll Lake County, which is a unique partnership and something that certainly other libraries and other counties and cities could look at, but it's a powerful partnership in Waukegan and really impressive. And I just want to remind everyone that the links that have been provided in these presentations will be available in the archive as well as on the archive page for you to reference, so you'll be able to get straight to them. And we are collecting your questions for the Q&A, so we'll be able to get to that in a few minutes. But first, we're going to hear from Lissa Staley. Welcome, Lissa, from the Topeka Shawnee County Public Library in Kansas.
Thank you. I'm the Health Information Librarian here, and in Kansas we have the Federal Exchange. As a librarian on the front lines, I know that we all want to help our customers and answer their questions. This emphasis on the marketplace and libraries is giving us a really great opportunity to advertise our services overall. As always, the library is here to help customers accomplish whatever they need to get done, and in this case it includes applying for insurance. I try to work in everything else too. When I was interviewed a few weeks ago in the local paper, my message was really simple. The library will provide information and handouts and computer equipment and referrals. I stressed to the reporter that those marketplace resources are great and that that's where she should send people for more information. But everything that libraries need is right there for us, or it will be soon. I'm excited about what's coming still. I think if you're looking for a strategy, I can share ours with you. Our plans in Topeka have all come together in the last few weeks. Our CEO said, "What are we doing for this?" And I said, "I'll get right back to you on that." Since the marketplace can be accessed online, I reserved our computer training center at a variety of dates and times, expecting that we'd be able to help people more in depth by giving them more computer time. I had dates and a vague description so that I could begin advertising those sessions right away. I added the healthcare.gov widget, which you can see very tiny in that screenshot, to our library's health website to remind customers and staff of that go-to place for more information. You won't have all the details today, and that's okay. Be transparent with your staff about what's still in the works. Be transparent with your public about what's still in the works and what the library can provide. For us, just-in-time training is scheduled closer to October 1st for frontline staff, who were thrilled to hear that local navigators and other assisters will be available in the fall for referrals. In the related resources for the webinar, I recommended a link labeled Identify Possible Partners, and I think that's the one that keeps getting posted over and over in chat also, to find those local people. I think reassurance is really important. I know we can do this. We're librarians. The skills being asked of us are some of our best skills. My coworkers are comparing this to income tax season. We don't do their taxes for them, but we help them get the forms, help them use the computers, provide the contact information for customer support, and locate the local in-person assistance that's available for them. This is something we're great at. Communicate your expectations to your staff and your coworkers. Make basic assistance with the health insurance marketplace part of everyone's daily work, same as any other reference question. A few things you could do extra to support your staff in this new thing would be make a display of handouts from the Marketplace Partners website and encourage staff to give those to customers and use those as a point of discussion. The interactions with customers will likely begin as directional or reference questions, and the customer may eventually be referred somewhere fancier like a trained navigator, but many customers can be directed to healthcare.gov by that first person who helps them at your library. And then decide what exceptions to your normal rules you could easily make. If you can help customers by extending their computer time or providing some free computer printing or allowing customers to use a library phone to call the marketplace support line, just decide as a library what you can do and then let all your staff know what the new rules are for helping with this. I really lucked into partnerships, so I did not want to focus on how magically lucky I was. So let me just say, our partnerships in Topeka have been successful because we've advertised to community agencies that we're very interested in outreach and partnership. We focused on what we can provide, which is access to computers, printers, internet, tech support for customers who aren't that confident in their computer skills, distributing information from reliable sources, and we're open a lot of evening and weekend hours that other agencies are not. That's really something libraries have going for them. If it's too late to schedule big events at your library this fall, consider supporting the plans of your community health partners, advertise or co-sponsor their events, and offer your library space to the local navigators and the certified application counselors, or whatever they're called in your area, as a neutral public space to meet our clients and use public computers. And I think Evan really had the best slide here. Don't get overwhelmed by the details. A simple goal is to increase customer access to information about the marketplace and increase opportunities for customers to successfully apply. From the ideas and the resources, hopefully you can choose a few things you can do to set up your staff and your customers for success.
Thank you so much, Lissa. I think you have an amazing attitude, and I think it is fantastic. And I think that the analogy that you made is certainly one that we've seen come up a lot with questions around providing access to this information, and that is similar to tax season, where a lot of libraries provide access to downloadable forms or computer time for patrons, and certainly provide access to the website and online information. And I think that's a very similar analogy here. Of course, there's an opportunity, as we have heard from the team in Waukegan, of taking it a step further, where they're going to be actually providing in-person assistance and working through a partnership. And so, the bottom line, and I believe is something we want to keep reiterating, it's finding the right path for your library. And a lot of that will come down to resources and time. So it's a matter of sitting down and devising a plan. And so with that, we've had the chance to hear from all of our presenters, and so we're going to take the next 20 minutes to talk about some of the questions that have come through for our presenters. And we actually have from CMS, we have David Santana, who is going to answer some of the questions that have come in regarding enrollment. So David, I'm going to start with you and a few of the questions that came up around eligibility. Can you talk, one of the questions that we saw a few times was about eligibility enrollments and citizenship. Can you talk a little bit about what the requirements are for being eligible to participate in the ACA?
Sure. There are four basic requirements to participate in a marketplace. They're really broad, nothing really new here. The first one is the fact that an individual needs to live in the service area. The service area of the marketplace is usually the estate. So you have to be a resident of the estate that you are applying for coverage. The second one is that you have to be either a U.S. citizen or national, or be a non-citizen or a national who is lawfully residing here in the U.S. So that means that an individual who, for example, is undocumented, they don't have any immigration status here in the U.S., they are not eligible to participate in the marketplace. Even if they want to buy health insurance and pay it on their own, they're not able to purchase health insurance in the marketplace. And the last one is that individuals cannot be incarcerated. That is because individuals in those institutions they get health insurance through other means, either through the state Medicaid or other means while they are in those type of institutions.
Great, thank you, David.
You're welcome.
And can you talk a little bit about whether or not it's beneficial for people who are check out the coverage that's available on the marketplace or through the marketplace?
The answer to the question is really depends. If you have a health insurance right now through either your own employment or through a spouse, the decision relied on the individual. So what we encourage individuals to do is that once the marketplace is open, if they wanted to go and compare a health insurance plan in the marketplace with what they currently have, they are certainly free to do so. A couple of things to keep in mind. There will be financial assistance for individuals in the marketplace, for example, to help them pay for their premiums and also to pay out-of-pocket expenses when they receive the service. Even individuals have an offer of health insurance through an employer plan to themselves, the individual itself, and spouse and family member, and that plan is affordable and it offers a minimum value. That individual, although they can leave that plan and go to the marketplace, they will not qualify for financial assistance if they have access to an employer health plan, again, that is affordable and also offer the minimum value. And that applies also to individuals who have access to government sponsored health plans, for example, Medicare, Medicaid, CHIP, Veterans Administration's health care, those who are enrolled in those plans, and as well as those who have access to TRICARE benefits. Those individuals have access to health insurance through those means, and therefore, even if they meet the financial requirement to qualify for the credits, they will not be able because they already have an offer through either an employer or through the government.
Great, thank you. Another area that has come up are definitely people are interested, especially because libraries might be looking to navigators or in-person assisters or counselors. Tarnisha mentioned that there is a searchable database coming in that's expected in September to help people connect to navigators. Will that include both the federal and the state-based exchanges, or just navigators in the federal exchange?
What would happen is if an individual is in a state-based marketplace, when they go to the website and that they choose, the first thing you will do is choose which state are you in, and you will be redirected to that state marketplace if it's a state-based marketplace, and you will be able to find information about which navigators participate within the state-based marketplace. So again, it's going to be a triage. Once you choose that state, then you're going to be sent to that state marketplace if it is a state-based marketplace.
And should, in the state-based marketplace, if libraries want to connect with their navigators or in-person assistance counselors, would they do that through their state-based exchange?
That is correct. Because the state-based marketplace, they have tons of flexibility under the Affordable Care Act, and then in terms of how they establish their navigators, in-person assister, as well as a certified application counselor. We do encourage you to go to the state-based marketplace, and there will be a toll-free telephone number that you will be able to call, and information on the website about how they're operating their marketplace, and of course the list of navigators and other assisters available to help individuals.
Okay. And we've talked a little bit, and I think there actually is a good link, and we'll be sure to provide it, but if you could talk a little bit about the navigator, in-person assister, and certified application counselor. Are all of those positions or all of those roles, are they required to get training?
All of them are required to get training. Navigator, we are expecting or kind of required that those navigators will go through 20 to 30 hours of training, and they have to pass a test. As well, at the end of the training, with the 80% level of above passing score, certified application counselor also will go through a training not as lengthy as the Navigator, but they will go through about probably like 5 hours of training as well. And then there's also a separate training for the in-person assister, which again is pretty much similar to the Navigator training. Agents and brokers also that will be available to help in the marketplace, also they will go through some sort of training as well.
Great. So lots of training.
Lots of training and certifications.
Wonderful. Okay, and a little bit about the enrollment period. I think we're now well aware that October 1st is the first day of open enrollment, and we know that March 31st, 2014 is the end of the period. Can people enroll after that time period, after that initial open enrollment period, and what would that look like?
Sure. The initial enrollment period lasts for 6 months. That starts in October 1st this year and ends on March 31st, 2014. After that initial enrollment period, in order to access the plan in the marketplace, you have to qualify for a special enrollment period that will allow you to access the plan outside of this initial enrollment period. Special enrollment period, for example, entails an individual who is losing, for example, an employer plan or some sort of plan that they have, and they're losing that plan. They can access the marketplace at that time after March the next year. For example, if you have extending your family, for example, if you're becoming independent, families that have children, getting married, getting divorced, things like that will allow you to kind of access a plan outside of that open enrollment period. For example, immigrants who are adjusting their immigration status here in the U.S. To the point that they would qualify to purchase a plan, they could do so at any time, if not at any time, but rather after they adjust their status. They have about 60 days to choose a plan. Gaining or losing eligibility for premium tax credit, we talk about that. Individuals who are applying for premium tax credit or losing the eligibility, they will be able to join a plan or change plan at that point. And of course, individuals who, for example, are moving from one place to another, and as a result of the move, they will have access to health insurance outside of that initial open enrollment period. So to sum up, there are many special circumstances that will allow an individual to join a plan outside of that initial enrollment period. Thereafter, we keep in mind that every year from October 15th to December 7th, individual will be able to join a plan or change plan at that point. So this is the 6 months here is just the initial enrollment period. Thereafter, every year from October 15th to December 7th, they can come and join plans or change.
Okay.
One more thing that I wanted to mention, because there is a question that comes up a lot, and that's a question of an individual who enrolled in a plan and then, in May or June say, this is not for me, I don't want to be enrolled in this plan. They will be able to drop that plan at any time. They just have to give about 14 days notice to the plan, so the plan can terminate their plan. But if you do that, just keep in mind that you won't be able to re-enroll again until the annual open enrollment period.
Thank you, David.
You're
I'm
welcome.
going to ask just a few more questions, and then we have a few for the team at Waukegan. And this is one that has come up a lot about online enrollment. And so, one, I want to clarify, because we definitely heard this before, is that online enrollment is not required and that a paper-based form is available and can be printed off. And you can confirm that?
That is correct. There are multiple ways that the individuals can go about applying. Again, the preferred method is online because you have the real-time response right there. But you can also do it by phone by calling them marketplace. You can do it by mail by requesting a paper application, or perhaps you just call the marketplace and say, I'd rather meet with someone in person to help me fill out that application. So there are multiple ways that they can go about doing that.
Great, thank you.
You're welcome.
Okay, I have a few questions now that have come in for the team at the Waukegan Public Library. One of them was about how you were able to determine how many people in your county were without health insurance. Did you do a statistical analysis, or was it other research that was conducted?
So this is Carmen from Waukegan. So as we mentioned, we are part of the Enroll Lake County grant, which is spearheaded by the Lake County Health Department, and they have done extensive market research on the community itself and how many individuals are currently uninsured in Lake County. And it was determined that our goal as a partnership with other organizations that are also part of the Enroll Lake County, that we would target to seek out and engage about 20 to 25,000 uninsured individuals in the community. I hope that answers the question.
It does, thank you. And you also mentioned that 3 of your staff were hired to become in-person counselors. Are these new staff that you were able to hire, or existing staff who have been trained?
And thank you for that question as well. The Enroll Lake County allowed us to utilize our existing staff. We had the option of hiring out, but we determined that within our staff, we were going to take an active role with Enroll Lake County and with the Affordable Care Act, period. So we've dedicated 3 individuals that are currently on staff. We didn't seek out to hire any additional staff. We used existing personnel and divided 40 hours amongst the 3 to dedicate to this program. The Enroll Lake County allowed us to get a grant, and this grant will be able to offset some of the expenses with our staff and personnel.
Great. Can you talk a little bit about how the partnership with the County Health Department has evolved and how you were able to build that relationship?
It's been a 2.5, almost 3-year process where we providers, community resources, came together and began to have focus groups and roundtable discussions to see how we could all collaborate and effectively serve our community with our human services better. And so it's been a long process of having one-on-one conversations and, again, focus groups to help us better determine how we can be relevant and serve community and addressing barriers and needs. So a strong partnership with the health department is very important in your organizations, in your libraries, because that's where it made the biggest difference for us.
Great, thank you. Now I have a few questions for Lissa at Topeka and Shawnee County. Lissa, could you talk a little bit about how partnerships have played a role in your community and in the services that your library plans to offer?
Definitely. As health information librarian, I've been sort of attending local coalition meetings where a lot of different people are getting together at the same table, and I just try to represent the library there. So as this came up, I just kept kind of politely raising my hand and saying, how can the library help? What do you need us to do? Those kind of things, so that as different things, including this, come up, they say, oh yeah, could you guys do this? Or, oh, could we hold our event at your library? Those kind of things. So we were doing a partnership with our local community health center on the Thursday that navigators were announced, and the person who got the navigator grant was at our event. So that's how those things kind of, like I said, I lucked into them, but at the same time I worked hard to get the library at the table for those things.
Great, thank you. And how have your patrons been responding to your efforts so far? Is it something that they're noticing and participating in?
I think for the most part, honestly, a lot of my handouts are still on the wall. People aren't picking them up, which I think is okay, because this doesn't start till October 1st. There's not much to do at this point. But I feel like staff are definitely feeling good that we have information up, we know where to walk people, we know how to answer their initial questions. And I just keep repeating, like my mantra is, everything will be in place by October 1st. Don't worry, because I think it will be.
That's great. Thank you, Lissa.
Sure.
All right. just looking back through some of the questions, I know there are a lot, and some of them are very specific. I'm not sure we'll get to all of them, but Tarnisha from CMS has been great. She's been putting in some of the answers to your questions. And David, I have a few more questions for you, and one is about the online enrollment and whether or not an email address will be required to submit an online application.
One of the things that the online application will require is for you to first the individual have to create an account. So they will be asking some specific questions in there. I'm not sure that ultimately will require an individual to have an email account, but they do certainly need to register or rather create an account. That in terms of the email address, I have to research that further and provide an answer to that later.
And the estimated online enrollment time, has there been an estimate of how long it will take to complete the federal application?
That would depend, of course, in the individual specific situation. You're talking if there is a single individual who is not asking to be screened for tax credit and co-sharing reductions, that the application is fairly fast. But of course, if you are a family of 5, 6, 8 individuals, that you have to input the information for each and every one of them. It's going to take you much longer to fill out an application, and of course, they're going to be asking for income information. They're going to be asking about whether you have an employer plan and what type of employer plan. So it's going to take much longer. Depends on, of course, in the situation of an individual.
Thanks, David.
You're welcome.
So we're at the top of the hour, and I know that there are still lots of questions and that there will continue to be questions as we move towards the open enrollment period. And some of these we're going to work to clarify to put on the Web Junction eHealth page. And so Jennifer Peterson has posted the link to our page that we will try and update, especially the questions that we have heard most frequently from participants in the webinars, and we'll continue to schedule events going forward as we have new information. And you can also sign up to receive updates from this project that relate specifically to libraries. For example, last week when the announcement was made about navigators being awarded, we sent out an announcement to the folks who are signed up to that list. So please consider that as a way to stay informed with the project. And you can also subscribe to Crossroads, which is our newsletter, and it comes monthly at the beginning of the month. And we really appreciate all the today's panelists for sharing their stories and information about the ACA and how libraries can help. And we look forward to hearing more about what each of you are doing. It's by far been one of the most amazing things is to get emails from libraries around the country who are sharing their stories with us, and we're starting to capture those so that we can share them back with you, because we know how powerful that is as an example that you can share with your staff, with your directors, with your board about how libraries can help meet some of these information needs in our communities. So thank you for all that you do and the time that you have spent in today's session. The archive will be posted and available, so feel free to forward that to any other staff that you think might be interested, and we look forward to bringing you more information soon. Thank you all so much. Have a great day.